Imagine feeling perfectly fine, only to later hear the devastating words, "If only we had caught this sooner." It's a reality that too many families face, a diagnosis that comes too late, when the chances of survival have drastically dropped. Stomach cancer is one of the deadliest diseases because it hides in plain sight. Every year, over 1 million people are diagnosed, yet 80% don't realize it until it's too late. What starts as mild discomfort or fatigue can silently develop into something life-threatening. But you don't have to be caught off guard. Your body speaks to you. It sends signals, sometimes small, sometimes persistent, warning you that something isn't right. The key to survival is recognizing these signs before it's too late. In today's video, Healthy Care will reveal 8 crucial early symptoms of stomach cancer that you should never ignore. Knowing them could save your life or the life of someone you love. Let's dive in. Stomach cancer, also known as gastric cancer, is a type of cancer that starts in the lining of the stomach. It usually develops slowly over many years, often without noticeable symptoms in the early stages. By the time symptoms appear, the cancer may have spread, making it harder to treat. This is why early detection is so crucial. Several risk factors can increase your chances of developing stomach cancer. One of the biggest is an infection with Helicobacter pylori, H. pylori, a bacteria that can cause chronic inflammation in the stomach. A diet high in salty, pickled, or processed foods also contributes, as do habits like smoking and excessive alcohol consumption. If you have a family history of stomach cancer or conditions like chronic gastritis or ulcers, your risk may be higher as well. The tricky part is that the early signs of stomach cancer can easily be mistaken for common issues like indigestion or stress. This makes it all the more important to stay vigilant about your health and pay attention to persistent symptoms. The earlier we catch stomach cancer, the better the chances of successful treatment. So let's dive into the key signs to watch for. 1. Burning sensation and persistent heartburn. Most of us have experienced heartburn, a burning sensation in the chest or upper stomach that's often linked to spicy food, overeating, or stress. But when heartburn becomes a constant companion or over-the-counter antacids no longer provide relief, it could be more than just acid reflux. Persistent heartburn or a burning sensation in the stomach might be caused by chronic inflammation in the stomach lining, which can mimic the symptoms of acid reflux. This inflammation could be linked to underlying issues, like tumors disrupting the stomach's normal functioning. What makes this particularly tricky is that these symptoms often overlap with common digestive conditions, making it easy to dismiss them as minor. Here's the important distinction: if your symptoms persist despite dietary changes or medication, or if they're accompanied by other warning signs like unexplained weight loss or fatigue, it's time to dig deeper. Avoid the temptation to self-medicate with antacids or proton pump inhibitors, as they might temporarily mask the symptoms but won't address the underlying cause. Consulting a doctor for a thorough evaluation is critical. They may recommend tests such as an endoscopy to investigate what's really happening. Persistent burning sensations or heartburn aren't just inconvenient, they're your body's way of signaling that something could be seriously wrong. Address it promptly to ensure early detection and effective treatment if necessary. 2. Swollen lymph nodes. Let's talk about a symptom that often flies under the radar: swollen lymph nodes. You might notice small lumps around your neck, collarbone, or even near your stomach. While swollen lymph nodes are commonly associated with infections like a sore throat, they can sometimes signal something more serious, such as the spread of stomach cancer. Lymph nodes act as your body's surveillance system, filtering harmful substances and fighting infections. When cancer spreads, it often travels to nearby lymph nodes first, causing them to swell. Unlike swelling from an infection, these lumps tend to be painless and persistent. They may start small but gradually grow over time, and they don't shrink or disappear on their own. It's easy to dismiss this symptom, especially if it's not causing discomfort. But persistent swelling without an obvious cause like a recent illness or injury deserves attention. If you notice any unexplained lumps that don't go away or, worse, continue to grow, it's time to consult a doctor. They may recommend imaging tests, a biopsy, or additional investigations to determine the cause. Remember, your lymph nodes are an important part of your body's communication system, signaling when something isn't right. Don't ignore them. Catching this sign early could provide crucial insights into what's happening in your body, allowing for timely intervention. So if you feel a lump, don't wait. Listen to your body and act promptly. It could make all the difference. 3. Blood in stool or vomit. One of the most alarming signs your body can give you is the presence of blood in your stool or vomit. While it can be unsettling to see, it's an unmistakable signal that something serious may be going on inside your body. Stomach tumors can bleed, and this blood often finds its way into your digestive tract. Depending on where the bleeding occurs, it may appear as bright red blood and vomit or dark, tarry stools resembling coffee grounds. These dark stools indicate blood that has been digested, which often points to bleeding higher up in the digestive system, such as the stomach. While blood in stool or vomit can sometimes result from less serious conditions like ulcers or hemorrhoids, it's not something to take lightly. The presence of blood, especially if it persists, warrants immediate medical evaluation. Ignoring it or hoping it will resolve on its own can delay a diagnosis and potentially allow a serious condition, such as stomach cancer, to progress. If you notice blood, don't wait. Call your doctor and explain your symptoms right away. Tests like endoscopy or imaging can pinpoint the source of the bleeding and help guide treatment. Early detection of the cause can save your life. Remember, your body doesn't send signals like this without reason. Listen carefully and act quickly. 4. Unexplained weight loss. Let's talk about something that might seem like a silver lining at first, but could be a serious red flag: losing weight without even trying. While many people celebrate shedding a few pounds effortlessly, unintended weight loss, especially over 10% of your body weight in a short period, can be a sign that something isn't right. Stomach cancer can disrupt your body's ability to absorb nutrients properly. Tumors interfere with digestion, making it harder for your stomach to break down food and for your body to absorb essential vitamins, minerals, and calories. This can lead to rapid weight loss, even if you're eating your usual meals. Additionally, stomach cancer can decrease appetite due to persistent nausea, bloating, or a general sense of discomfort after eating. Chronic fatigue and anemia, which often accompany the disease, further contribute to unintended weight loss by draining the body of energy and reducing physical activity. If you notice that the numbers on the scale are dropping without any change to your diet or exercise habits, it's crucial to see a doctor. Don't dismiss it as a lucky accident. It could be your body sending a serious warning. A medical evaluation, including blood tests and imaging, can help determine the cause and rule out potential health concerns. Unexplained weight loss is a call to action, not a celebration. Address it promptly to ensure early detection and intervention if necessary. 5. Stomach pain and bloating. Stomach pain and bloating are symptoms most of us have experienced at some point. Maybe you ate too much, or your stomach didn't agree with what you had for lunch. But what happens when that discomfort doesn't go away? No matter what you eat or how carefully you manage your diet, the pain lingers. Persistent stomach pain and bloating can be much more than just a digestive inconvenience. They might be your body's way of signaling a serious underlying issue, such as tumor growth in the stomach. Tumors can create blockages in the digestive tract, preventing food from passing through smoothly. They can also cause inflammation and disrupt the natural balance of stomach acid, leading to ongoing discomfort that doesn't improve with antacids, dietary changes, or over-the-counter remedies. This isn't the kind of pain that comes and goes after a heavy meal. It's a consistent, gnawing discomfort that might even grow worse over time. If you find yourself constantly dealing with this kind of bloating or pain, it's essential to take it seriously. What should you do? First, stop self-medicating. Proton pump inhibitors or antacids might mask the symptoms, but they won't address the root cause. Instead, talk to your doctor and explain your symptoms in detail. Persistent pain is never normal. It's always worth investigating. Early detection and diagnosis could make a significant difference. So don't delay taking action. 6. Persistent nausea and vomiting. Now let's move on to another critical warning sign: persistent nausea or vomiting. Everyone experiences an upset stomach from time to time. Maybe it's a bad meal, stress, or even a stomach bug. But when nausea lingers for days or episodes of vomiting start to occur frequently without any obvious reason, it's time to pay closer attention. Tumors in the stomach can interfere with the normal digestive process. They might partially block food as it passes through, irritate the stomach lining, or cause other disruptions that lead to ongoing nausea or bouts of vomiting. Over time, this can create a vicious cycle, where your body struggles to keep food down, leaving you weak and malnourished. It's easy to reach for antacids or over-the-counter remedies to try to calm your stomach. And while they might provide temporary relief, they can also mask symptoms, delaying a proper diagnosis. Persistent nausea isn't just an inconvenience. It's your body signaling that something deeper might be wrong. If you find yourself frequently nauseous or vomiting for no clear reason, don't brush it off as a passing issue. Schedule a visit with your doctor and explain exactly what you're experiencing. Comprehensive testing, such as imaging or endoscopy, can help uncover the cause. Remember, early action is key. It's better to investigate now than to wait until the problem becomes more severe. Listen to your body and don't let these warning signs go unnoticed. 7. Anemia and fatigue. Let's talk about a sign that many people might brush off as just being overworked or tired: persistent fatigue. But this kind of exhaustion goes beyond needing an extra cup of coffee. It's a deep, unrelenting tiredness that affects your whole body. When stomach tumors bleed, even a little bit over time, it can lead to chronic internal blood loss. This ongoing bleeding often results in anemia, a condition where your body doesn't have enough healthy red blood cells to carry oxygen effectively. Without enough oxygen, your body struggles to perform even basic tasks, leaving you feeling drained and weak. You might notice you're out of breath after climbing a flight of stairs, or that your skin looks unusually pale. Maybe you're finding it harder and harder to get through the day, even with plenty of rest. These aren't just signs of a bad week. They could be your body's way of telling you something more serious is going on. So what should you do? If this sounds familiar, talk to your doctor and request a simple blood test to check your hemoglobin levels. This test can quickly identify anemia and help pinpoint whether internal bleeding might be the cause. Don't ignore persistent fatigue. It's not something you should just push through. It's your body's alarm system, and catching this sign early can lead to timely diagnosis and treatment, possibly preventing something much more serious. 8. Feeling full quickly. Imagine sitting down to enjoy a meal you've been looking forward to. But after just a few bites, you're done. Not because you're satisfied, but because something feels off. You're uncomfortably full, even though you've barely eaten. This sensation can be caused by tumors or abnormal growths in the stomach. These growths can physically reduce the stomach's capacity, making it feel like there's simply no room for food. Sometimes, they can even block parts of the digestive tract, disrupting the normal process of emptying your stomach after meals. Over time, this can lead to nutritional deficiencies, weight loss, and other serious complications if left unchecked. It's easy to miss this symptom as a temporary issue, perhaps due to stress or a change in appetite. But here's the key: if you notice this sensation persisting, especially when you're maintaining your usual diet and activity level, it's important to take it seriously. The best course of action? Don't wait. Reach out to your doctor and explain what's been happening. They may recommend tests like an endoscopy or imaging to get to the root of the issue. Remember, your body has a way of speaking to you. Listening to it could make all the difference in catching a problem early. Safeguarding your health against stomach cancer starts with smart, proactive choices. Your daily habits and lifestyle play a significant role in your overall risk, and small adjustments today can help prevent serious health concerns in the future. One of the best defenses against stomach cancer is a well-balanced, nutritious diet. Prioritize fresh, whole foods such as fruits, vegetables, and whole grains, which are rich in antioxidants and essential nutrients that help maintain a healthy stomach lining. Meanwhile, it's important to limit your intake of processed, highly salted, or preserved foods, as they contain additives and compounds that may impact stomach health over time. Smoking and excessive alcohol consumption are also linked to an increased risk of stomach-related conditions. Smoking can damage stomach tissues, while alcohol can irritate the stomach lining, making it more susceptible to long-term health issues. If you currently smoke or drink heavily, cutting back or quitting can greatly benefit your well-being and lower your risk. Beyond lifestyle improvements, early detection is a key factor in improving treatment outcomes, especially for individuals with higher risk factors, such as a family history of stomach conditions, persistent digestive issues, or bacterial infections like H. pylori. Scheduling routine checkups and screenings can significantly increase the likelihood of identifying health concerns before they become serious. Some of the most effective medical tools for early detection include endoscopy, enables doctors to closely examine the stomach lining and identify any abnormalities. Biopsy allows specialists to analyze small tissue samples for unusual cell growth. Imaging tests helps detect irregularities or mass formations in the stomach area. Don't wait for severe symptoms to appear. If you experience persistent discomfort or notice any concerning signs, seek guidance from a healthcare provider as soon as possible. Early identification increases the chance of effective treatment and better recovery outcomes. Your daily habits have a significant impact on your overall digestive wellness. Chronic stress can contribute to digestive discomfort, so incorporating stress management techniques, such as mindfulness, breathing exercises, or physical activity, can support better gut health. Additionally, staying active through regular exercise helps improve digestion, circulation, and immune function, making it easier for your body to defend itself against potential health risks. If you or someone close to you has been diagnosed with stomach cancer, support is available. Consult with specialized medical professionals, such as gastroenterologists or oncologists, to explore the best available treatment options. Connecting with support groups can also offer valuable emotional guidance and practical advice from individuals who have faced similar challenges. Understanding the warning signs of stomach cancer can make a crucial difference. Symptoms like ongoing nausea, unexplained weight loss, or digestive discomfort may seem minor at first, but they could indicate a more serious underlying issue. Taking action early is key. The sooner a potential health concern is identified, the better the chances of effective treatment. If you or someone you know experiences persistent digestive symptoms, don't overlook them, schedule a checkup and prioritize your health. Raising awareness can save lives. Share this information with your loved ones. A simple conversation could encourage someone to seek medical advice at the right time. For more valuable health insights, subscribe to our channel, Healthy Care. By staying informed and proactive, you can take charge of your well-being and help others do the same. Stay aware. Stay proactive. Stay in control of your health.